There's no such thing as a typical patient. Every patient comes in as unique and individual, having a different history and a different set of problems. Some patients have had their problem for 1 month, for example. Some people have had their problems for 6 years, 10 years. Some people have leg pain, some people have back pain, some people have both. Some people have pain everywhere, their neck, everywhere. So no, there's no such thing as a typical patient. To give you an example, a patient that was in here this morning that you met, he had problems in his feet, he had problems in his back, down his leg, his neck, and in a short period of time we had diagnosed him, we had treated him, he's improving. He did need some MRI scans, which we arranged, and he did need even some injections, which I was able to arrange, which he had done here at the clinic as well, and also in the hospital. But we're still treating him, and he's making a fantastic recovery compared to how he was in, say, 4, 5, 6 weeks ago. He's like a different person, you know? And to be fair, he's a young man as well too. So it's not just old people that have problems. It's not just people who work. So for example, when they're standing long periods of time, they're putting pressure on their back, which is causing the spine to move. And then, of course, the nerves, the center that comes through the holes in the side here, end up being pinched or trapped, and therefore they get pain in the back. And of course, if you look over here at the chart, that the pain can travel from here down the legs as well. So when we start to manipulate and fix these problems, the pain will go. Of course, the women are all, not all, but obviously some of them are at home. They're cooking and cleaning and looking, and equally so, they have back problems, and they'll have problems with their spine as well too. Or looking after children is another one. And of course now, because of lockdown and because of COVID situation, a lot of people are working from home. And when they're working, they're sitting at a laptop at a kitchen table. Not an ideal situation because they're not in the office, not working at a desk. And this is creating problems in their neck and their lower back. And again, these are problems that we can fix quite straightforwardly as well too. In mentioning about COVID, just to let the patients know that although we're in the middle of a lockdown, which I appreciate, we're open, completely normal for business. We're as busy as always, but we can always fit patients in. If you call up, quite often you can get an appointment on the same day, and patients are being looked after the same. Since the pandemic started in March, in February, March, we've been open the majority of the time and have been busier than ever and able to accommodate anyone. So anyone that has any problems or suspected problems and they're tired essentially of suffering with their pain, give us a ring and I'm sure we'll have a look, and more often than not we can help you. And if we need to send for MRI scans or injections or speak to the doctors, we can do all that as well too. So we're here to help people whatever their problems may be.